You're right, if someone doesn't want a particular form of help, then you can't help them. And yet, that's not how the Mental Health Act works in Queensland. If a patient says no to a treatment option and is deemed to have a mental illness, as Gian was, then saying no means that you'll be met with force. It doesn't matter to Queensland Health or the Office of the Health Ombudsman how destructive both physically and mentally that might be. If you said no, then you will be blamed for whatever harm comes to you. This is coercive control. Gian was a child and sexual abuse survivor with an eating disorder. Her parents fought for her to receive trauma-informed care. As a sexual abuse survivor, Gian was then put through forced feeding several times a day. Forced feeding as a procedure is not trauma-informed and is directly comparable to rape. This is what is reflected in the international research and is known to cause physical injuries to the patient if they are refusing the procedure. On top of this, Gian was being sexually abused by a nurse at Robina Public Hospital while she was admitted there. The evidence of this was found on her phone after she died. Unfortunately, staff who abuse patients like this have not been held accountable when reported to the Office of the Health Ombudsman, so the abuse has been able to continue against other patients. Restrictive practices removed Gian's right to simply say no and have her bodily autonomy respected. Gian never should have been put through what she was, and staff who abuse patients in those settings are able to get away with it because our so-called independent systems of investigation keep closing cases of mistreatment, neglect, abuse, and torture in the same facility, regardless of the evidence provided to them of human rights atrocities.